Hypnotics like Xanax, and you've got Benadryl, which is a sleeping medication,
Oh,
right?
put you to
It's
sleep.
an allergy medication that if I take even one Benadryl, I'm in the fetal position in a corner somewhere.
Oh no, yeah.
Now
Coke. You're not asleep.
we're getting to the Coke.
Okay.
We're getting to the Coke. So you add them all up, and they synergistically work together to cause you to be super sedated. You could easily be so sedated on all of that medication that you just pass out and you end up drowning in a bathtub.
Yeah.
Now the kicker is what she's saying, which is Coke. So a lot of people think if you take enough sedatives and you go down, but you take Coke and you come up, that you'll be neutralized. But what happens is you develop tolerance when you've done cocaine for a long period of time.
And that she had clearly this had been a problem for her, and her mom said that she was shocked that her daughter was using cocaine, that she had thought that she was sober, that perhaps though the anxiety over this big comeback that was planned for her may have caused her to relapse again. And as addiction specialist, you, I'm sure, see that.
Yeah, and relapse happens all the time, right? That's common, and it especially happens with stressors. The more stressors you have in your life, the more chance there is for relapse. With cocaine, there's an outside chance that she might have had a heart attack, and her heart may have been compromised because of all the cocaine use, causing atherosclerosis. It's like your artery gets smaller and smaller and smaller because there's caked up things in your artery, and a heart attack could have caused her to go into the water.
Robin, what about legally? Where do we go from here? Is there any place to go from the family? They're saying it's accidental.
In short, no, but I have a quick question from a legal point of view. I mean, from just a medical legal point of view, if I'm putting this case together, are you saying that she drowned first and then whatever other heart things may have also played a role, or did the other stuff happen first and then she drowned? Because that timing would play a role in terms of, not in terms of charging a case, but in terms of causation and figuring out where the liability may be.
Well, if you look at the likelihood of having a heart attack from cocaine, it definitely happens, but there's a much higher likelihood that you took those other medications, they all worked together to put you asleep, and then you fell into the bathtub and you drowned. There's a much higher likelihood and possibility that that's what happened.
So
I mean, this case is going nowhere. It's going, and the combination is something that we thought was going to be here. I mean, erratic behavior that we saw the night before, the drinking, the known drug user. I mean, no one wants to talk about the fact that Whitney Houston was a known drug user, and no one wants to mar her memory. But the fact of the matter remains is that she is responsible for her own drug use, and if those other pills were there, you can't point the finger there. There's no way.
even the various prescriptions, the Xanax, the Flexeril, all of that.
Those just are too normal, too common, and nothing that you could say that anyone would have overprescribed or overdone or over the realm of what would be normal. The only thing that I would be interested in is, would any of this have an effect in terms of her potential civil wrongful death suit if the family was trying to seek that?
If there is one. Okay.
Yeah,
And you know what? We actually have to move on, but we have both of you coming back for other topics, so don't go too far. We do have some